Sit up, guys.
Hey, guys.
We'll do time each night. If we're up to it, if you have no medication, we're trying to do a little demonstration class. Tonight we're going to do reflexes, and I'm going to show you how to check for reflexes. And then when we're done, I have a reflex hammer for everybody to keep. So each of you get your reflexes. There are several ways of checking reflexes, and this is something that's been going on for a long, long time. Reflexes are one of the ways of checking the neurological system. It's not technical, it's not difficult to do, and it gives a wealth of information, okay? It goes from everything from when people are pregnant and they come in and they have what we call preeclampsia, which is very high blood pressure during pregnancy. We give them medications, we can monitor the medications and monitor their risk of having a seizure. Preeclampsia is a life-threatening illness, and so if they're having poor reflexes, we have to give them something called magnesium to prevent seizures. Somebody comes in with the seizure, we can do reflexes. Somebody comes in with a stroke, we can check reflexes. And because of a change of mental status, sometimes they passed out or they had a seizure, they had a car accident. So there's a lot we can learn for the mental status, okay? Now, reflexes have been around, and testing for it has been a long, long time. England is the premier place of neurology. You want to learn neurology, they don't do MRIs, they don't do CAT scans, they do the physical exam. And in my training, I think, and Bob in our day, we were taught to do the exam, to get the history from the patient. We didn't have a lot of equipment. When I was in medical school, CAT scan didn't exist. People don't even want a CAT scan. Everybody wants an MRI today. Well, we were doing it at a time before that existed, and we did just as well. So I'm just going to show you what we have here. I'm going to hand out something different for you, but this is the set of instruments the doctor would use for reflexes. Okay? There's different kind of hammers. They all work similarly. This is the more traditional one that we use. It's rubber on one end, very sharp end. Can I have you demonstrate? Okay. So what we're doing is we're stretching muscles and nerves, okay? I don't want to get too complicated in the neurological system, but there's a short circuit that the spinal cord has to the body. And this circuit prevents injuries to the bone. If you touch something that's hot, the reflex is so sudden, you don't have to think about hot, you withdraw before you get injured. Okay? This is the system that we're working with. So when we're doing this, we have a person relax himself. Now on this portion, I'll stretch the ligament by putting my finger on it, and this is a short tip. Okay? Now you don't want to hammer it like you're hammering a nail. You want to let it drop. You want the weight of the hammer to hit. You're not going to hurt them because you're hitting your finger. Okay? You have them relax, and you hit it, and the muscle will contract. You may not always see it. Sometimes you'll feel it. Like somebody's, just put your knee up, a leg up over here for me. I'm just doing an exam, okay? I may tap her in, this reflex. But I may put my hand over here. I may not see it, but I'll feel the muscle contract. I'll feel a little twitch in the muscle, okay? And you can do that. Now, there are some illnesses that this doesn't extinguish. After a while, the muscle kind of calms down, doesn't do it so much. The broad end is for doing bigger muscles. If I'm checking this muscle over here, instead of a little tap, I'm hitting with a broader muscle, okay? The other hammers are very similar, done differently. This is very popular in England. This is the kind of reflex hammer they like to use. And again, it's just allowed the weight of the hammer to drop. You want a certain weight to hit. And you want to be consistent. If I'm hitting this way every time, I'm not being consistent. If I let the weight of the hammer drop every time, if I'm hitting the left side or the right side, I'm being even. So when you do that, think of that. You're going to let the weight of the hammer drop, okay? There's another smaller hammer that's sometimes used in the U.S. This is very popular, okay? This is a double-sided hammer, again, for bigger muscles or smaller muscles. It also has other little features in it. Some of the reflex hammers we give you will have this. If somebody's diabetic, you want to check if they've had a stroke, do you feel sharp or dull? So a little pin, you're not going to hurt them. Tell them, do you feel sharp or dull? So if they've had a stroke, do they have muscle injury or do they have sensory injury or both? And sometimes if I can't move my arm, well, do you feel your arm? So I would do this. I take the dull side and tap, do you feel sharp or dull? Sharp or dull, they would feel that, okay? Another thing that has in the hammer, this particular hammer has, in the base of it, is a little brush. Okay, a little brush. And again, it's very light. And again, for diabetics, somebody that has a stroke, I can test them. Very light touch on the skin. Almost just touching the surface, getting the little hairs on the surface of the skin. Do you feel touch? Do you feel sensation? This is another little test we can do. So it's not just banging the arm, banging the muscle. It's to check for other reflexes, other sensations people have. It's very important because the kind of stroke people have will let us know what to expect to recover, what kind of rehabilitation, what therapy they'll need. And the last one we use, you wouldn't think it was a reflex, but it is. It's vibratory sense. Okay? So you have many senses. You can tell hot, cold, sharp, or dull. We have a sharp or dull. Okay, hot or cold. Sometimes you take metal. Even at room temperature, metal feels cool. And you touch the metal to them. Or you take a cool object. Okay, something like this. And touch it to them. Okay, does this feel hot or cold? That's important, okay? And then the last one is vibratory sense. So I'll take this and I'll touch it, not against the skin, but against the bone. I'll find a bone. And I'll ask them, do they feel this? Do you feel that vibration? Okay. This is very helpful. So now we know if we can develop the senses. There are some people who are born with certain neurological illnesses. I had one patient who was born with the inability to sense hot or cold. It's very dangerous. Okay? You know, you hot or cold shower, take a shower, touch a bath, you have a drink. They come all these horrendous scars going on as a child. They can touch a stove and not feel that. They don't sense that. This is something that they're born with. Also, after certain injuries, that'll happen too. So another thing we can do, if somebody comes in, we've seen in the clinic today, people say, I can't hear, I'm deaf. Okay, the first thing we would do is we take a look in the ear. Is there wax there? That's causing hearing loss, okay? If there's no wax there, I still say I can't hear, but they have fluid behind the ear, an infection, allergies, stuff like that. So we can sometimes determine from, again, testing for vibratory sense, do they have a hearing loss? Can we help them? Now, if they have a hearing loss, and I hold this tuning fork, I'll let it pass it around, you hear a little vibration, you hear that? The low frequency vibration. In my office, I have several different styles from low to high. And if they can hear this, then, okay, hearing aid might help them because they have nerve conduction. Let's say they don't hear it. My next question is, do they have bone conduction? Bone conduction is more sensitive, actually. So what we'll sometimes do is we'll let this vibrate, and I'll hold it by the mastoid bone, because right behind the ear, the mastoid bone. And I'll tell them, keep listening, keep listening. When they don't hear it anymore, then I'll hold it by their ear. It's still vibrating, but not enough that they can hear it through the bone conduction. Now I'll hold it on the outside. If they hear it, they have good nerve conduction. Another sense we can do, it may look sunny, but I did it in the clinic today. Some of you may have seen it. People come in, I can't hear. Okay, we can call lateralization. I'll make this tuning fork vibrate. I'll hold it in the middle of their head, right up here, with their eyes closed. It helps them concentrate. Then they hear it equally in both ears. If they don't, then one side may have a neurological injury. Okay? And a hearing aid may or may not help them. Again, these are some of the tests we can do without MRI, without CAT scan. We don't need any EEG. We don't do any special picture of the test. These are things in our hands that we can do. What we're going to do is we're going to break up into small groups. Okay? I have Dr. Bob, I have Chris, myself. Alex will help us. Andrew. No name tag. Don't do that to me. Okay, Andrew will help us. So I have 4 kits. We'll show you some of these things and let you try them out between each other. Then at the end I have some reflex hammers I'm going to give you. Some are 2 different shapes. Let me just show you real quickly. Okay, there's 2 different shapes. This is a round kind similar to what's used very common in England, okay? And the same thing, it's a very simple use. This is a very small end and a wide end. Some of them have a filament, okay? And this filament is to check for light touch, okay? You can stroke the area for light touch or tap, because there's a stiff filament, to see if they have sharp touch, okay? This is very helpful. Pass it to Andy. All right, so we're going to break up this into small groups, do some reflexes, okay? And I'll give each of you a hammer at the end. Okay, so you want to take that group over there, over there, I'll take the group over here. If I hold my arm out here, this is not going to get a reflex. It has to be relaxed. Sometimes I'll tell the person, I'll hold their extremity. Okay, I'll hold it. Otherwise, if you have an extremity that's relaxed, okay, you see, I'll press over here. What I'm doing is I'm looking for a ligament. I can do it above or below. I'm going to do it over here. This is the patella ligament. I'm just going to get a nice tap. Okay, and you feel that jump? Okay, I'm not sure. I can feel the muscle jumping. Try it on yourself. Try it on yourself. Have you done it? Look at it. You can see it vibrating. Reflex. Put it on your.
It's like way low. You move them down, can't you? And then just make it higher or lower.
But if you're trying, it's the best way to get that one.
If you want to get 2 counters between yourself,
Try to bend the person's elbow a little bit. Keep it right on their biceps tendon.
heavy.
Why don't you try
You want to have
some meat?
I'm mimicking.
No, you don't check me first.
Right.
You have to check on it.
Ready?
No.
How do I do this?
First off, you want to have it
Relax, baby, relax.
So just got a little pressure.
go ahead.
Well, because you get the sensation. And she's like, then you try to do her reflexes or reflexes like that, right?
Are you
Did you get it? Try with this one. Let this one just kind of flop down and hit it. It's a little heavier. Bounce it off there.
Because I'm doing it like right along.
Your conduction is bone conduction and nerve conduction. So someone said, I don't hear well, hearing it can help me. Somebody doesn't have this ability, hearing it won't help me because they have nerve conduction. And the hearing it has to run only from nerve conduction. Same for you. You get So we all have normal conduction. Now you can do this on each other. Another thing we'll do is we'll check for vibratory sense. Somebody can just had a stroke and they can't use it all. You need to know what sensation they get. If they don't have sensation, then you have to do therapy for them. How can you walk if you can't feel the floor? Alright, as far as they're concerned, they step on the ladder with your dog. You don't know where to put your foot. You're always reaching, they're going to fall, okay? So you do the same thing. You can do it on any bone. It can't be on flesh. It can't be on the muscle group. It has to be on bone. So a kneecap, edge of a wrist, okay, on the side of the ankle, on the tip of the toe. So I'll do it. You don't have to hit it too hard. And you want to hit it on a hard surface. I'll hit it on the palm of my hand and on the bones. And you feel that? And you see, does that feel equal? Okay, so that's important to know because you want it to be symmetrical. Luckily, we have 2 arms, 2 legs, so it can be symmetrical. If it's not, it makes me wonder: is there a nerve injury? Okay.
It's I feel it more than I do.
I think I felt it more on my right side. I felt
I felt it on my left side.
I was really center.